Angelman Syndrome, AS, is a rare but serious neurogenetic disorder that affects the brain and nervous system, causing developmental delays, balance issues, lack of speech, and a distinctively happy demeanor. Although first identified in 1965 by Dr. Harry Angelman, it remains underdiagnosed due to its similarities with other conditions. What causes Angelman syndrome? Angelman syndrome is caused by a problem with a gene called UBE3A, located on chromosome 15. Normally, we inherit one copy of this gene from each parent. In most cells of the brain, only the copy from the mother is active. The father's copy is usually silent. In individuals with Angelman syndrome, the maternal UBE3A gene is missing, mutated, or not working properly. This disruption affects normal brain development. The symptoms usually become noticeable between 6 to 12 months of age. Some of the most common signs include developmental delays such as sitting, crawling, or walking late, lack of speech or very limited speech, frequent laughter and smiling, often with an excitable personality, balance and movement issues, ataxia, seizures, typically starting before age 3, sleep disturbances, fascination with water, microcephaly, a small head size in some cases. Despite these challenges, children and adults with Angelman syndrome are typically very affectionate and happy. How is it diagnosed? DNA methylation testing detects 80 to 90% of cases. UBE3A gene sequencing, fluorescence in situ hybridization, FISH and microarray tests to detect deletions. Early diagnosis is crucial for starting supportive therapies. Is there a cure? Currently, there is no cure for Angelman syndrome. However, several therapies and interventions can improve quality of life. Physical therapy to improve movement and coordination. Occupational therapy to build daily life skills. Speech therapy, even if verbal speech is limited, alternative communication methods like sign language or tablets can help. Anti-seizure medications to manage epilepsy. Behavioral therapy for sleep or emotional regulation. Research is ongoing, with promising developments in gene therapy and antisense oligonucleotides that may restore UBE3A activity in the future. Living with Angelman syndrome. Raising a child with Angelman syndrome presents challenges, but with love, early intervention, and community support, individuals can thrive. Many families report that their children bring immense joy and light to their lives. Support organizations like the Angelman Syndrome Foundation and FAST, Foundation for Angelman Syndrome Therapeutics, offer resources, community connections, and updates on research. Angelman syndrome may be rare, but the strength of those who live with it and their families is anything but. With awareness, understanding, and scientific advances, we move closer to improving the lives of those affected by this condition.